disease caused by one of the two poultry-adapted strains of Salmonella bacteria, Salmonella Gallinarum. This can cause mortality in birds of any age. Broiler parents and brown shell egg layers are especially susceptible. Chickens are most commonly affected, but it also infects turkeys, game birds, guinea fowls, sparrows, parrots, canaries and bullfinches. Infections still occur worldwide in non-commercial poultry but are rare in most commercial systems now. Morbidity is 10 to 100%, mortality is increased in stressed or immunocompromised flocks and may be up to 100%. The route of infection is oral or via the navel, yolk. Transmission may be transovarian or horizontal by fecal-oral contamination, egg-eating etc., even in adults. The bacterium is fairly resistant to normal climate, surviving months, but is susceptible to normal disinfectants. Salmonella infections in poultry can be divided into host-specific infections and non-host-specific infections. Host-specific infections: Polarum disease. Infections with Salmonella polarum usually cause very high mortality in young chickens and turkeys within the first 2 to 3 weeks of age. In adult chickens, mortality may be high but frequently there are no clinical signs. The route of infection is oral, via feed or litter, or via the navel, yolk. Also transmission via the egg appears. Clinical findings and lesions: birds may die in the hatchery shortly after hatching. Affected birds huddle near a heat source, are anorectic, appear weak and have whitish diarrhea around the vent. Survivors are small in size and frequently become carriers with localized infection of the ovary. These birds can continue to infect other birds. In mature chickens, chronic infections produce lesions indistinguishable from those of fowl typhoid. Fowl typhoid: the causal agent of fowl typhoid is Salmonella Gallinarum. Like S. polarum, S. Gallinarum is egg-transmitted and produces lesions in chicks and poults. However, there is a much bigger tendency to spread among growing or mature flocks. Mortality in young birds is similar to that seen in S. polarum infection but may be higher in older birds. Clinical findings and lesions: clinical signs and lesions in young birds are similar to those seen with S. polarum infection. Older birds may have a fever, be pale, dehydrated, and have diarrhea. Also the liver is swollen, brittle and often bile-stained. Non-host-specific infections: paratyphoid salmonellas are non-host-specific, for example S. Enteritidis and S. Typhimurium. They are the cause of salmonella food poisoning in humans. Fowl paratyphoid. Paratyphoid infections can be caused by any one of the many non-host-adapted salmonella. These salmonella infect many types of birds, mammals, reptiles, and insects. Paratyphoid infections can be transmitted to humans via contamination of poultry products. S. Enteritidis and S. Typhimurium are among the most common salmonella infections in poultry. The prevalence of other species varies widely by geographic location. Transmission usually occurs directly from infected birds, contaminated environments, or infected rodents. Infected birds remain carriers of salmonella. Clinical findings and lesions. Although not common, clinical signs are sometimes seen in young birds. Mortality is most often limited to the first few weeks of age. Depression, poor growth, weakness, diarrhea and dehydration are symptoms of the disease. Lesions may include an enlarged liver with necrosis, unabsorbed yolk sac and enteritis with necrotic lesions in the mucosa. Sometimes there may be no lesions due to acute death caused by septicemia. Other names: Salmonella infection. Salmonellosis is the name of a collection of diseases caused by infection with the Salmonella bacteria. Depending on type of Salmonella they are infected with, illness will manifest as aerosonosis. Aerosonosis is a septicemic disease of young turkeys, sometimes chicks, caused by Salmonella enteric subsp. Arizoni, S. Arizoni. The disease presents in both acute or chronic form and is characterized by septicemia, neurological signs and blindness. Pillarum disease, PD, pillarum disease, also referred to commonly as bacillary-white diarrhea, is an acute systemic disease of young chicks, caused by infection with S. pillarum. It is mainly a problem for newly hatched chicks, which begin to show clinical signs of infection within a couple weeks upon hatching. Chicks may be seen huddling under heat sources, making continuous faint chirping and peeping noises. These chicks will also develop white chalky droppings that cause them to develop white pasted vents, known commonly as pasty butt. Fowl typhoid, FT. Fowl typhoid is an acute or chronic septicemic disease that usually is most significant in growing and adult chickens and turkeys. It is caused by infection with S. Gallinarum. Clinical signs differ depending on the severity of the infection. Infected chickens often will die 5–10 days following when they first develop clinical signs. Paratyphoid, PT, infection. Paratyphoid, PT, infection is a common disease of chickens, usually more significant to younger chicks than for adults. It is caused by several different strains of Salmonella spp. The most common being S. Typhimurium and S. Enteritidis. As Salmonella often colonizes in the intestinal tract, this, and its contents, should be cultured. Salmonella can spread to many tissues including ovary, spleen, liver, yolk sac, heart blood, kidney, gallbladder, joint fluid, pus and the eyes. All of these can be cultured as part of a post-mortem examination. Samples of feed, water, or litter can be collected and tested for the presence of Salmonella. Sterile cotton swabs can be used for isolation. Cotton swabs can be dragged along litter to check for environmental contamination or be used to check breeder nests, laying cages or hatchery machines. There are a wide range of rapid Salmonella detection techniques, including enzyme immunoassay, antigen capture assays, DNA probes, and immunofluorescence. Signs: dejection, ruffled feathers, inappetence, thirst, yellow diarrhea, reluctance to move. Post-mortem lesions: bronzed enlarged liver with small necrotic foci, and/or congestion, engorgement of kidneys and spleen, anemia, enteritis of anterior small intestine. Every effort should be made to eradicate FT and PD, and treatment should be the last option. Various sulfonamides, followed by nitrofurans and several other antibiotics have been found to be effective in reducing mortality from FT and PD. However, most studies have indicated that despite treatment, a significant number of infected birds can remain among the survivors and become carriers. Care must be taken to follow the directions given by the manufacturer in regard to the route of administration, dosage, duration of treatment, and the withdrawal period for each antibiotic before use. A choice of antibiotics available for use varies by country. Supportive care: isolate the bird from the flock and place in a safe, comfortable, warm location, your own chicken intensive care unit, with easy access to water and food. Limit stress. Call your veterinarian. Ampicillin 50, water-soluble powder, dosage, orally through drinking water. 4 grams per 20 liters of water for 3 to 5 days. Chloramphenicol water-soluble powder, dosage, orally through drinking water. 1 gram in 5 liters of water or 50 grams in 100 kilograms feed. Doxetin vet powder, dosage, orally through drinking water. 1 gram per liter of drinking water for 3 to 5 days. Trimsulf WS, trimethoprim and sulfamethoxazole water-soluble antibiotic powder, dosage, orally through drinking water. Chicks, up to 8 weeks, 1 gram per 2 liter for 5 to 7 days. Adults, above 8 weeks, 1 gram per 1 liter for 5 to 7 days. Homco pH, dosage, orally through drinking water. 1 milliliter per liter water twice for 3 days. Ciprocin vet solution with moxicil vet powder, dosage, orally through drinking water. 1 milliliter per liter water ciprocin solution with 1 gram per liter water of moxicil vet powder for 3 to 5 consecutive days. Vaccination as part of a salmonella control program contributes to the achievement of salmonella-free poultry meat and eggs. Live and inactivated salmonella vaccines are available. Vaccination against salmonella protects chickens from infection or reinfection through vermin in the environment, infection from contaminated feed, spread of an undetected infection, spread of infection in the hatchery, mainly in the hatchers. The offspring of vaccinated birds are protected by maternal antibodies. Spread of infection in a flock where a few chickens are not protected. The basis for the successful control of salmonella infections in poultry farms is good farming and hygiene practices and the testing and removal of positive flocks from production. Vaccination of chickens is regarded as an additional measure to increase the resistance of birds against salmonella exposure and decrease shedding of salmonella. Salmonella vaccines currently authorized for use in poultry in the member states have been authorized on the basis of the mutual recognition procedure. Both live and inactivated salmonella vaccines are available. At the moment, the extent of vaccination in different member states differs considerably. The panel concluded that vaccination is useful in control programs targeting S. Enteritidis and S. Typhimurium. The use of vaccination and different vaccines, living or inactivated, is dependent on the prevalence of these serovars in the flock, and the type of flock involved, breeders, layers or broilers. A vaccine called MONARCH, used for typhoid infection, is available worldwide. It is a rough strain of Salmonella Gallinarum, Chiviprust and Barrow, 2008, but in most countries, it is not allowed in broilers, because it interferes in the serology monitoring of chicken meat. If used, it will protect against both Salmonella Gallinarum and Salmonella poultry. The new vaccine, MONARCH 1, is applied to baby chicks via spray in the hatchery. The vaccine stimulates immunity in the chickens, preventing salmonella infection during the growing period, which may result in contamination and subsequent foodborne infection of humans. Drinking water administration, remove disinfectants, sanitizers and antimicrobials from the drinking water 24 hours before and after vaccination. Mix vaccine in clean water which contains no disinfectants, sanitizers or antimicrobials. Use 50 liters of water for each 5,000 birds. Provide ample space for all birds to drink easily. Water containing vaccine should be consumed in 2 hours or less. To assure all birds drink, withhold water for 1 hour prior to vaccination. Coarse spray, aerosol, administration. Rehydrate the vaccine with cool distilled water which contains no disinfectants, sanitizers or antimicrobials in an amount sufficient enough to vaccinate the required number of birds according to the directions of the spray cabinet or field sprayer manufacturer. Field spray application should be used only in houses that can be tightly closed. Close all windows, doors, vents, etc. and turn off fans. Spray each 5,000 doses of vaccine directly into the faces of 5,000 birds. Leave house closed for at least 15 minutes after spraying. Always use appropriate personal protective equipment during vaccination. Salmonella can be controlled with the successful combination of several strategies. 5 principles for Salmonella control. 1. Salmonella-free day-old chicks, parent stock, hatchery, transport. Salmonella is transmitted vertically, via the egg from parent to chick. Thus an obvious starting point for any salmonella control strategy is to ensure poultry breeding flocks are kept salmonella-free. 2. Rearing chicks in salmonella-free environment. A. All-in, all-out management. B. Vector control, wild birds, flies and rodents. C. Visitors. D. Good cleaning and disinfection protocol. 3. Salmonella-free water and feed. A. Pelleted feed contains 10 times less salmonella than non-pelleted feed, thanks to heat treatment. B. Antibiotics can cause resistant salmonella, affect the resistance of the animal against colonization. C. Addition of organic acids enhance salmonella destruction. D. Drinking water sanitizer. 4. Regular monitoring of total production chain. According European legislation, the production chain is regular monitored by sampling of poultry flocks. 5. Immediate action when salmonella is detected. A. Determination of the origin of the infection. B. Movement of poultry flocks at the end of the production cycle should only be allowed for slaughter or destruction. C. Poultry litter, feces and other potentially contaminated farm waste should be disposed of in a safe manner. D. Particular care should be taken in cleaning and disinfection of the poultry house and equipment. E. Before restocking the facility, a bacteriological examination should be carried out. F. Adequate time should be allowed between flocks if previous flock was Salmonella positive. G. Buildings, surfaces and equipment should be cleaned and disinfected properly.